When I see a patient in the office, the first thing I do obviously is to diagnose their hair loss. Even patients with hair loss that can be treated surgically may not be good candidates for surgery. What makes someone a good or a bad candidate for surgery? It has to do with many factors: age, degree of hair loss, color of their hair, potential for hair loss in the future, family history of hair loss. All these things are taken into consideration when I'm telling someone whether you need surgery or not. The best candidates are men or women in their 30s or 40s. Their hair loss is already significant enough that bothers them. And we of course rule out every other type of hair loss that could not be treated with surgery. And then they are willing to do some kind of medical therapy to stabilize the loss, because hair loss tends to be progressive over time. And they have abundant donor hair, the hair on the back of the head that doesn't fall out. And they understand the limitations of the surgery. It's still a procedure. We make sure that the expectations are correct.